Minister, I'm persisting with the issue of recognition of long COVID and COVID as a prescribed illness. Now, I fully accept that under the terms of our occupational illness scheme, that if this recognition is provided, it will lead to just a handful of claims coming forward, if any at all. However, Minister, its recognition will have significant implications for medical assessments for illness benefit, invalidity pension, disability allowance and the entitlement to disablement benefit.
Thank you, Deputy. The Government acted early and without hesitation to support all workers who contracted COVID-19 during the pandemic. Workers could avail of an enhanced illness benefit payment, and eligibility criteria were set to include the largest cohort of workers possible, including the self-employed. The scheme paid some 578,000 claims at a cost of over €350 million. A temporary scheme of paid leave was developed by the Department of Health for certain public health sector employees who were unfit to work after a COVID-19 infection. This scheme has been extended until the 31st of March 2024. Special leave with pay for COVID-19 was also introduced for public sector workers. The European Commission has made a non-binding recommendation on the recognition of COVID-19 as an occupational disease. The Commission did not make a recommendation in relation to long COVID. The decision regarding recognition is for each individual member state, and it's important to note that recognition of COVID-19 in Ireland would not encompass long COVID and would only apply to new claims for new cases of COVID-19, and it would not benefit those who contracted COVID-19 during the pandemic. A recent report which we have published and laid before the Oireachtas found that COVID-19 does not meet the criteria for recognition as an occupational illness under the Social Welfare Consolidation Act 2005. Specifically, presumptions about workplace transmission would not be sustainable on a general basis in the current environment when infection rates are low. The statutory criteria for occupational injuries benefits specify that the disease or injury was caused as a risk of the person's occupation and is not a risk outside of that profession. Community transmission became dominant by the summer of 2020. Therefore, it's not been possible since then to establish with confidence a general assumption that the disease has been contracted through their occupation and not through community transmission. My department continues to provide a suite of income supports to those who cannot work due to illness and disability, including long COVID. I trust this clarifies the matter for the Deputy.
Minister, the difficulty is there's quite a number of contradictions here. If we look to other EU countries, every other EU country has recognised COVID as an occupational illness except Ireland and Greece. The Department of Health and the HSE have recognised long COVID for anyone that was infected up to the 15th of November 2021, which is a full year and 3 months after that threshold that you just spoke about. And at the moment, Minister, there are 143 healthcare staff that have been in receipt of payments for in excess of 28 months, recognising long COVID as an illness within the health service. The difficulty is for anyone within the health service that contracted it since the 15th of November 2021, or all other frontline healthcare workers. Their long COVID illness is not being recognised at the moment, and we're treating employees very differently depending on where they were doing their frontline work.
Thank you, Deputy. I mean, I can't comment on the Department of Health scheme that's covering healthcare workers. I don't know the ins and outs of that, but I think we'll all agree that there was, I suppose, specific dangers and vulnerabilities that they faced, which were different to many other workers whose main, we suspect, reason for contracting COVID was community transmission. I think it's important to say that now COVID, as recognised by WHO, is endemic now. It's an illness, I suppose, similar in statute to the flu, for example, that it does cause significant problems, but is one we have a degree of control over as well. I think it's important to say that. Look, my advice on discussion with officials is that it simply doesn't fit in terms of what we can fit under the Social Welfare Act in terms of eligible illnesses at the moment, and that's the advice I have.
Minister, up to last June, the figures provided from your department to me showed that approximately 750 workers who contracted COVID and were out of work for over 12 months were in receipt of a social welfare payment. And this doesn't include those who made a recovery from long COVID or from COVID and subsequently had a relapse of long COVID. Now, Minister, we're only seeing the very tip of the iceberg here in relation to this condition. This condition needs official recognition. It needs to be defined as a prescribed illness. And if we continue to officially brush this illness under the carpet, then people are going to be denied the legitimate supports that they need. And we're not going to put an effective strategy in place that we can ensure as many of these people can return to work. And that ultimately needs to be our priority.
Thank you, Deputy. I mean, the last thing I want to do and the last impression I want to give today is that we're brushing this disease under the carpet. Long COVID is very real. I know a number of people who still have it as well, and I think there's been significant response to the reality of long COVID by the Department of Health with the opening of quite a number of clinics and the expansion of clinics across the country as well to help people to deal with it and to help us find solutions to it as well. Obviously, this department does have a role for people who are unable to work due to illness. At the moment, that role fits in with our mainstream regular payments in terms of, I suppose, initially illness benefit, which does have a significant coverage period as well, and hopefully not, but if it goes beyond that then as well, the disability allowance payments will be relevant. And I suppose there's a broader suite of payments that is available to people who can't work because of illness, and that's where we see our role in this challenge at the moment. Thank you.